The environment. In this module, we will look at some tips for resolving and preventing problems caused by environmental factors during the dive, and the effects these factors have on the human body. Dangers of the diving environment. The places you dive may have particular environmental conditions, such as low visibility, water temperatures near zero, strong currents. Remember that all your diving qualifications certify that you are sufficiently trained to dive in conditions similar to those in which your training took place. If you find yourself in situations that do not conform to these conditions, you must refrain from diving. To prevent you having to do this, you can acquire the necessary knowledge and skills by attending the PSS specialty courses. Assess the environmental conditions carefully before diving, and always take into account that these conditions can change suddenly. Visibility. Sediment and mud that has settled on the bottom can rapidly reduce the visibility to zero when it is stirred up by the current or by divers using incorrect finning techniques. The most common consequence of this is loss of visual contact with your group and buddy. If you also happen to be diving near a wreck, the loss of visibility means that there is also the risk of injuring yourself, damaging your equipment on the sharp parts of the wreck, or becoming entangled in abandoned fishing nets or lines. To prevent this happening, you should control your buoyancy, use the correct finning technique, and attach all the hoses and any loose equipment firmly to your BC. Stormy seas, rain, or the proximity of the mouth of a river can stir up suspension on the seabed or sediment and make the water very turbid. Using a dive light doesn't help because the glare reflecting on the suspension in the water tends to dazzle you and make the situation worse. Using a strobe light is the best way of locating your buddy. If low visibility is a characteristic of the places you usually dive, it would be useful to attend the PSS Limited Visibility Diving Speciality course, which, thanks to the special training you will receive, will provide you with sufficient experience to carry out dives in low visibility safely. Diving in conditions of extremely bad visibility, known as zero visibility, is not an activity for recreational divers. Currents. Currents can be encountered on any dive, and the change in direction and their intensity may be sudden. Strong currents can tire you easily, influence your buoyancy, cause you to lose equipment, complicate any eventual emergency, and lead to other negative consequences. The sensation of being carried along by the current and no longer being in control may even cause a diver to panic. If you dive in areas where there are strong currents, you should attend the PSS Drift Diving Speciality course. Cold. In order for the human body to work at its best, it should have an internal temperature of around 37.5 degrees Celsius, 100 degrees Fahrenheit. A sophisticated system of thermocontrols keeps the temperature more or less constant, particularly for the vital organs such as the brain, heart, and kidneys. When the body overheats, excess heat is expelled through dilation of the vessels in the skin and perspiration. On the other hand, if we lose body heat because we are in a cold environment, the system of thermocontrols increases the production of heat and vasoconstriction of the blood vessels in the skin occurs. When the heat loss is greater than the body's ability to produce it, the core body temperature begins to decrease. This condition is called hypothermia, when the body's core temperature is less than 35 degrees Celsius. or 95 degrees Fahrenheit. Due to its importance, there are 3 recognized stages of hypothermia. It is considered slight when the body's core temperature is higher than 34 degrees centigrade or 93 degrees Fahrenheit, and the victim is still fighting against the cold. In the moderate stage, the core temperature is higher than 30 degrees centigrade or 86 degrees Fahrenheit, and all the vital functions slow down and alterations in the heart rate are possible. In its severe form, the core temperature falls below 30 degrees centigrade or 86 degrees Fahrenheit, cardiorespiratory arrest, and finally death. The PSS First Aid (CPR) course teaches how to deal with such cases. During the dive, it is essential to reduce the amount of water that enters the suit so as to prevent hypothermia. Ensure that the suit is the right size, fits well, and has good seals around the neck, wrists, and ankles. It is not always easy to recognize the first symptoms of the body cooling down while diving. Shivering is the most important alarm signal because it is the only sign that is evident and occurs when the heat loss begins to exceed the body's ability to produce heat. At the first sign of shivering, you must get out of the water immediately and warm up, otherwise the body temperature will continue to fall to a dangerous level. Your body can also cool down during the surface interval between one dive and the next, particularly if you don't change out of your wet dive suit. In this case, in addition to the heat lost due to thermal conductivity, there is also the considerable heat loss due to the evaporation of the water in the suit. This heat loss is even greater if it is windy or the boat is moving. To avoid excessive cooling, take off your wet dive suit, get dry, and put on warm clothes. Heat. To make the dispersion of heat easier, our organism increases the surface area where thermal exchange takes place by dilating all the superficial blood vessels of the skin, cutaneous vasodilation, and stimulating the production of perspiration. When this capacity of dispersing the excess heat is no longer sufficient, the internal body temperature begins to rise, and a condition known as hypothermia occurs. Putting on your suit a long time before the dive may bring about an excessive rise in the body temperature, particularly if it is hot and sultry or if you have to do some physically demanding task. The body's core temperature will begin to rise. It may even exceed 41 degrees Celsius or 106 degrees Fahrenheit. And if measures are not taken to reduce it, there is a risk of suffering from heat exhaustion. The first signs, such as exhaustion, feeling generally unwell, and lacking concentration, are not always easy to recognize. When the compensation mechanisms no longer function, heat exhaustion turns into heat stroke, which compromises the functioning of the vital organs and can lead to coma and even death. The PSS First Aid (CPR) course explains all the symptoms of hypothermia and the first aid techniques for dealing with heat stroke. In order to prevent heat exhaustion or heat stroke while diving, you need to drink a lot of fluids, assemble your equipment in the shade before putting on your suit, and coordinate with the other divers so you do not have to wait in the sun with your suit on. If you do have to wait in the sun, jump into the water or pour buckets of water over yourself. If you are wearing a dry suit, leave the zip open to let air in. If you have already closed it, you can ventilate the inside by putting fresh, dry air into the suit using the inflation valve and expelling the warm, damp air through the dump valve. Seasickness. The term seasickness is used to indicate the particular pathological form of motion sickness many people suffer from that is caused by the movement of a boat or dinghy. When the body is subject to irregular movement, such as the acceleration and deceleration due to the movement of the waves, the various systems that are dedicated to the control of balance transmit a series of conflicting information to the central nervous system. For For example, the sensors of balance indicate a great deal of movement, but the eyes, which are maybe looking at something inside the boat, only note small oscillations. The brain reacts to these conflicting signals in an irregular manner. Seasickness begins with a general feeling of discomfort, accompanied by pallor, cold sweats, and anxiety. This is followed by nausea and vomiting. If you know that you suffer from seasickness, think ahead. Don't set out on a boat trip on an empty stomach, but eat small portions of plain, dry food at regular intervals, and don't go below deck. When the boat begins moving, look at the coast. A fixed reference point puts an end to the conflict between your eyes and the centers of balance. Relax and try to remember that psychological factors, particularly anxiety and emotivity, play a fundamental role in making you feel seasick. If you do feel a little nauseous, lie down in the open on the lowest part of the deck with your eyes closed. When you get to the dive site, prepare your equipment quickly and, if conditions allow, wait for the rest of the group in the water. You may also suffer from motion sickness under the water. Certain environmental conditions, such as a strong undertow, a rough sea, poor visibility, type of seabed, may cause a sense of feeling unwell, dizziness, nausea, and vomit. In this case, try to look at a fixed object, the seabed, a wall, or your buddy, and close your eyes for a few seconds and breathe regularly. Obviously, there is medication against seasickness, but this often causes drowsiness and reduced concentration, collateral effects that are potentially dangerous while diving. However, any medication must be taken 1 to 2 hours before getting on board the boat. There are also non-pharmacological treatments available, such as anti-sickness bracelets, but these remedies have not been scientifically proven, although some people claim they are effective. Respiratory problems. Coughing. The function of coughing is to expel the foreign body, such as abundant mucus produced by bronchial mucus, water, or the small particles of suspension in the respiratory tract that have irritated the major airways. A cough consists of 3 phases, and we will examine each one separately since each phase can cause different problems on the dive. In the first phase, there is deep, rapid inspiration that creates a strong demand for air. In this phase, the lips may tend to widen around the mouthpiece to increase the quantity of air that enters the airways, but this also favors the inhalation of water during a dive. In the second phase, known as tension, the glottis closes, the vocal cords move closer to each other, and the larynx is blocked, preventing air from escaping. If you lose control of your buoyancy during this phase, you tend to ascend a few meters and therefore risk a lung overexpansion injury. In the third phase, expulsion, the glottis opens instantaneously and the air, previously held in, is violently expelled. The risk in this phase is that of loosening the grip on the mouthpiece, causing the second stage of the regulator to fall out of your mouth. If you do have to cough, use one hand to hold the second stage in position and stay at a constant depth, and try to stay there until the coughing fit has passed. Sneezing. Sneezing is a sudden occurrence that is set off when the sensory nerves signal the presence of foreign particles. Sneezing can create difficulties, even serious ones, if it occurs on a dive. In the first phase, the airways are closed and the intrapulmonary pressure increases while the nose is completely blocked by mucus. As soon as the pressure in the airways becomes sufficiently high, there is a sudden muscular spasm that makes you expel the obstruction violently. At the same time as you sneeze, the eyes will close as a reflex action. Also, in the case of sneezing, controlling the depth and holding your second stage in your mouth with one hand are essential techniques. Don't try to hold back the sneeze by pinching your nostrils, because the mucus, instead of being forced out, could be pushed inside the sinuses and the eustachian tubes, with the risk of these orifices becoming blocked and causing serious difficulties on ascent. During the sneeze, leave the nose free and do not hold the mask pressed against your face. In this way, the mucus expelled by the air can come out without obstruction, thus freeing the airways. Once the sneeze has finished, apply the technique for clearing a flooded mask that you learned on the PSS Open Water Diver course. Retching. In most cases, vomiting during a dive is connected to an altered physiopathological state, heat exhaustion, seasickness, a heavy meal, dizziness, and so on. Generally, vomiting does not occur suddenly, but is preceded by an increase in salivation, a sensation of nausea, and feeling generally unwell, accelerated breathing, and weakness. As soon as you feel any of these symptoms, rest on the seabed if it is nearby, or hold onto a line, a wall, or a dive buddy so as to stay at a constant depth. Hold your second stage firmly in your mouth and maintain control of your breathing. However, despite these efforts, you could begin retching and actually vomit. Retching holds back the breath, while there is lengthy contraction of both the diaphragm and the abdominal muscles, which consequently sneezes the stomach and causes the contents to be expelled. You must deal with this situation as calmly as possible if it does occur. Hold your second stage firmly in your mouth and maintain control of your buoyancy. However, after vomiting into the second stage, the first breath should be taken carefully. Once the retching has passed, clean the second stage in the water by pressing the purge button. If you can't do this, use the auxiliary second stage and try to clean the main one by putting your finger inside. If you cannot unblock it, ascend to the surface with your buddy without forgetting to respect the correct rate of ascent and the safety stop. Breathlessness. Doing something physically demanding underwater, such as swimming against the current or transporting a diver in difficulty, may bring about a sensation of air starvation and make you breathe shallower and faster. Stress can also make your breathing shallow and fast. But this air starvation tends to make you breathe even faster. This type of ventilation does nothing to improve respiratory exchange. In fact, it makes it worse. When breathing is fast and shallow, most of the air that goes into the lungs is that contained in the main airways and dead air spaces, namely the air we breathe out on the last exhalation. Gas exchange is reduced, and the result is uncontrolled breathlessness and a continuous reduction of oxygen in the body and a gradual accumulation of carbon dioxide. If you start feeling out of breath, stay still and stop doing whatever is making you breathless and take 4 or 5 long, deep breaths. Prolong the expirations and try to empty your lungs completely. Inhaling should be slow and progressive. Concentrate on each breath, extending each one to last 5 seconds. Once you have gained control of your breathing again, check your air supply, because a breathless diver can consume 5 to 6 times more air than normal. If conditions allow, you can continue the dive. If you feel yourself getting breathless again, interrupt the dive immediately and ascend with your buddy, observing the correct ascent rate and the safety stop. Hyperventilation and hypoventilation. Hyperventilation consists of a repetition of deep maximal respiratory acts, meaning from completely full to completely empty and vice versa. This way of breathing can help overcome breathlessness, but is certainly harmful if it is used for long periods during a dive. Initially, it slightly increases, about 25%, the flow of oxygen to the cells and eliminates the excess carbon dioxide. But if the situation continues, the supply of oxygen does not increase further, while the loss of carbon dioxide in the blood continues. Hyperventilation for long periods during the dive can make you feel dizzy, cause a sense of unreality, agitation, pins and needles, numbness around the mouth, in the fingers and hands, muscular spasms, and irregularity in the heartbeat. In order to reduce their air consumption, some divers alternate 2 deep breaths with a pause in respiration. This is known as microapnea. This technique is dangerous both mechanically, due to the risk of potential barotraumas, and physiologically, in that it leads to an accumulation of carbon dioxide. Suffering from a headache after the dive is a typical symptom of hyperventilation. Barotraumas can occur both during the descent and the ascent. In order to avoid a barotrauma, you must prevent an imbalance of pressure occurring in the cavities. Compression barotraumas. The most common compression barotrauma is that involving the middle ear. While descending, water in the outer ear pushes the tympanum membrane inwards, and in order to avoid the eardrum introflecting excessively, air must be emitted into the middle ear through the eustachian tubes, using a technique known as compensating or equalizing. The tearing of the eardrum causes acute pain, sudden dizziness, and a loss of orientation. And there is also the risk of getting a middle ear infection due to water getting inside the ear. Right from the first few meters of the descent, equalize delicately. If you begin to feel a sensation of tension or slight pain in your ears, ascend a few meters and repeat the equalizing maneuver again. But this time, try tilting your head from side to side until the discomfort disappears. Only after you manage to equalize and the feeling of discomfort disappears can you continue with your dive. Another gas cavity, partly rigid and partly flexible, is the cushion of air trapped inside the mask. Because the face seal is soft, this cushion of air reduces in volume under the effect of the increasing pressure. However, when the mask can deform no further, for example because the rigid frame is pushing against the nose, the pressure inside the mask will be less than the external pressure, and this causes a suction effect or squeeze. This depression causes the delicate tissues, such as the ocular conjunctiva capillaries, to break, leaving the eyes literally injected with blood. In order to prevent these problems occurring, remember to equalize in the first few meters of the descent and blow a little air out through your nose. Other, less frequent barotraumas caused by compression can affect the paranasal sinuses if they are inflamed. In this case, the suction effect during the descent causes them to fill with mucus and blood and also causes acute pain. This can be prevented by not diving when you have any symptoms of sinusitis or congestion of the paranasal sinuses. A very painful but luckily rarer event may involve teeth that are decayed or have imperfect or damaged fillings. During the descent, the pulp and tissues of the dental alveoli may be drawn into the cavity and cause a lot of pain. Decompression barotraumas. All the gases present in the body in a free form expand during an ascent and have to escape in some way so as not to cause injury. For example, if the air cannot be released from your lungs, the overpressure may cause overexpansion of the pulmonary alveoli, which can have extremely dangerous consequences. One of the most serious of these consequences, such as arterial gas embolism, can even cause loss of consciousness and respiratory or cardiorespiratory arrest. On the PSS, First Aid, CPR, and Oxygen in Diving Emergencies courses, you are taught the correct procedures for dealing with such situations safely and competently. When diving, you must respect all the rules that help prevent these serious incidents. Breathe regularly and never hold your breath. Constantly control your buoyancy and depth. Always make ascents at the correct rate and carry out safety stops. Making a fast ascent while holding your breath, as people in panic often do, is extremely dangerous. The most common and most easily dealt with decompression barotraumas affect the middle ear and paranasal sinuses. Usually, the cause is mucus obstructing the connections with the outside of the body. During the ascent, you will feel pain in the affected area and may even feel dizzy, particularly if one ear is free and the other remains blocked, causing what is known as alternobaric dizziness. If this occurs, stop the ascent, descend a few meters, and wait a few moments. Do not try to compensate, as you risk increasing the pressure of the mucus in the affected cavities. As soon as the symptoms pass, continue the ascent, but much more slowly. During the ascent, you could also suffer from stomach pains due to air expanding in the intestinal tract, a condition often referred to as diver's colic. In this case, you should also descend a few meters and try to expel the air naturally, and then continue the ascent more slowly. To prevent the formation of air in the intestine, avoid eating leavened food and drinking fizzy drinks before diving. In the next module, we will look at how to assist an exhausted diver, establish the priorities of our actions, and learn how to deal with and prevent stress. See you soon.